practical and emerging information on disc degeneration and spinal arthritis. Do your X-ray and MRI findings matter as much as you were led to believe they matter? Hey folks, I'm Dr. Jeff Williams. I'm the orthopedic specialist here at Creekstone Integrated Medical, and I'm going to share some information that I promise you or your loved ones need to hear. Let's say that you had x-rays for one thing or another. The provider comes back with the results. They sit you down, they're very serious about this, and they're concerned. They said something similar to one of the following sayings. It's bone on bone. It's a degenerative disc disease. It's a bulging disc. Oh, it's a herniated disc. I'm really concerned. It's arthritis in your spine. It's stenosis. It's a decrease in the curvature of your neck. Oh, I'm so concerned. It's not a matter of if you'll have surgery. Wait for it. It's a matter of when you'll have surgery. Oh, goodness. It's so awful. That last one, oh, it's the worst. And it should never be uttered, by the way. It's not a question of if you're going to have surgery, but when. Please, can we remove that from the vernacular of every provider ever born? So here, I hear this stuff from patients in my clinic literally every single day. All of those sound absolutely terrible and terrifying, am I right? But what if I told you that not only can you not make a diagnosis based solely on an X-ray or an MRI report, but what if I also told you that the majority of X-ray and MRI findings are absolutely normal? They're a normal part of aging, and the majority of them cause zero pain and zero loss of function at all. You probably wouldn't believe me because we've been taught the biomedical model our whole lives. Here's the issue. We need to shoot it with a needle, put medicine on it, or cut it out, and people are going to be great. Heck, a large number of providers globally are still unaware of the information I'm sharing with you today. So essentially, you could consider yourself at the forefront of the current understanding of pain, okay? So as the Australians would say, good on you, mate. But we've learned more about pain in the last 10 years than we knew over the previous 1,000 years. And the research coming out monthly on pain is absolutely staggering and continues to be pretty eye-opening and I would say encouraging. I could really get off into the weeds with pain and venture off into neurology and the biopsychosocial construct of pain, blah, blah, blah. But I've covered some of that in my previous blogs and previous videos here on YouTube for you to go and check out. But for many of you, if I went into all that stuff, your eyes are just going to glaze over and you're going to go, you're going to split. I'll lose you. Instead, I'm going to share a graphic with you that recently came out from Spine Care Partners that demonstrates really clearly that findings on MRIs and X-rays don't typically mean issues in the patient that is sitting directly in front of the provider. Now, when you look at this graphic and you see the percentages, the age groups are on the top line. The columns are for the percentage of those people in that age group that have those issues, that have zero pain and full functionality. So every percentage on this graphic here I'm sharing with you, every person on there has zero pain. But they've got all of those issues on their MRI or X-ray findings, but they don't hurt at all. No issues. So for example, the research is crystal clear. Degenerative disc disease is not a disease, by the way. It's part of the natural, normal aging process and typically causes no pain. 68% of 40 to 50-year-olds have degenerated discs with zero pain and full functionality. Almost 70%, folks, zero pain. In fact, I would not even mention degenerative discs to a patient in my clinic unless it's somehow relevant to what's going on with the patient, and that's what brought them into my clinic. That's part of their complaint. Then I might mention it. Now, most of the time, it's not relevant because it's normal. We providers have the literal ability to convince patients that they are broken and should be careful for the rest of their lives because they're fragile. We have the ability to communicate poorly with the patient and condemn them to chronic pain and a sedentary lifestyle because they're convinced they're going to further harm themselves if they do anything. If they're too active, they might break themselves further, right? Or we have the literal ability to pull them away from chronic pain. We can communicate optimistically and encourage the patient to be and to stay active and to understand that hurt doesn't mean harm. Work through the pain, but do not become sedentary, because sedentary leads to deeper chronic pain, increased depression and anxiety, and sleep disorders, and that's just naming a few issues. And when providers better understand the findings in an X-ray or an MRI report, they are better at communicating them in a way that's not catastrophizing and detrimental to the patient's physical and mental future. And if you've received discouraging news from a provider that you went to about your X-rays and your MRIs, and you'd like a second opinion, I really invite you to call us at 806-355-3000. Get on our schedule. Come see us today, or at least give us a call today, and let's get you started, all right? Let's take a look, and let's help clarify or explain things. And if we find something different than your other provider, we'll tell you about it. But I can tell you, experience matters, and being an orthopedic specialist like me really can make a difference in what diagnosis and what treatment you end up going through. Now, the right decision can change everything. So make sure that your healthcare decisions are made on solid knowledge and research. And if you're watching us on social media, please share this, subscribe, comment, like, and all of the other goodies. It is the way. Until next week, I'm Dr. Jeff Williams. Thank you for listening and watching. Be smart, watch our other videos, and we'll see you then.